Have you been feeling tired all the time, struggling with brain fog, or dealing with stubborn weight that just won't budge? What if these seemingly unrelated symptoms might all stem from the same root cause? Today's video will reveal what might be the most overlooked health crisis in America: chronic inflammation. This isn't just another health buzzword. The research is clear. Chronic inflammation is linked to everything from obesity and diabetes to depression and Alzheimer's. But here's what's truly shocking. Significant inflammation can be present in the body without any obvious signs. Stay tuned for the next few minutes, because this information could completely transform your understanding of health symptoms and provide actionable steps to reclaim vitality. Understanding inflammation types. Let's start with the basics. Inflammation itself isn't inherently bad. It's actually a critical defense mechanism. When a finger gets cut or the body catches a cold, an inflammatory response is launched. The area becomes red, hot, swollen, and painful. This is acute inflammation, and it's essential for healing. But there's another type of inflammation that's far more insidious: chronic, low-grade inflammation. Unlike acute inflammation, it's not visible to the naked eye. It persists for months or even years, silently damaging tissues and organs. According to research published in Nature Medicine, this type of inflammation is now recognized as the common underlying factor in most chronic diseases. The American Journal of Clinical Nutrition has linked it to metabolic syndrome, which affects nearly 34% of American adults. The gut inflammation connection. What many people don't realize is that approximately 80% of the immune system resides in the gut. This isn't just interesting trivia. It's crucial to understanding how inflammation develops. The intestinal tract isn't merely a digestive organ. It serves as a critical barrier between the external world and the internal environment. Everything consumed enters the digestive tract and must be processed before absorption. The gut contains an enormous amount of immune cells in what's called the gut-associated lymphoid tissue, or GALT. This tissue constantly monitors what enters the body and is essential for recognizing and fighting harmful agents like pathogenic bacteria, viruses, and toxins. A 2020 study in the journal Frontiers in Immunology demonstrated that gut dysbiosis, an imbalance in the gut microbiome, directly activates inflammatory pathways throughout the body. This is why gut health is no longer considered a niche interest, but a fundamental aspect of overall health. The digestive process and inflammation. Origins. Let's walk through the digestive process to understand how inflammation begins. The mouth digestion starts in the mouth. Saliva contains enzymes that begin breaking down food. This is why eating slowly is essential. It gives the body time to produce sufficient saliva with these crucial enzymes. Research from the University of Rhode Island found that people who eat slowly consume about 10% fewer calories per meal. When eating mindfully, without distractions like TV or smartphones, the body efficiently activates hunger and satiety hormones. Another fascinating aspect is the relationship with sweet tastes. Constant exposure to sweet foods causes proliferation of taste buds that detect sweetness, creating an escalating cycle of sugar cravings. However, and this is important, the palate is adaptable. Studies show that reducing sugar intake for just 2 weeks can significantly decrease cravings and increase sensitivity to sweetness. The stomach. After the mouth, food travels to the stomach through the esophagus. The stomach needs to be acidic to efficiently digest proteins, which are broken down by hydrochloric acid in gastric juice. Many people mistakenly believe that gastritis means having too much stomach acid. In reality, the stomach lining is protected by a mucus layer. Gastritis occurs when this protective barrier is compromised, not because of excess acid. This misconception leads to another problem: the chronic use of acid-reducing medications like proton pump inhibitors, PPIs. A study in the Journal of the American Medical Association found that long-term PPI use is associated with nutrient deficiencies, bone fractures, and increased risk of infections. These medications reduce stomach acidity, leading to hypochlorhydria, low stomach acid, which severely compromises digestion. The intestines. When proteins are poorly digested due to low stomach acid, they reach the intestines in larger molecules than ideal. These partially digested proteins become food for harmful bacteria in the gut. These bacteria ferment the residues and release toxins that produce enzymes weakening the intestinal barrier. This not only causes gas and bloating, but, over time, leads to intestinal dysbiosis, an imbalance in the gut microbiome. Leaky gut syndrome. With a weakened intestinal barrier, substances that should remain blocked can enter the bloodstream. This condition, known as increased intestinal permeability or leaky gut syndrome, was once controversial but is now recognized in mainstream medicine. A 2020 review in the journal BMC Gastroenterology confirmed that increased intestinal permeability plays a role in numerous conditions, including inflammatory bowel disease, celiac disease, food allergies, and even neurological disorders. Immune activation and cytokines. When these foreign particles enter the bloodstream, they trigger a chronic activation of the immune system. Immune cells release inflammatory cytokines, chemical messengers that signal something is wrong. These cytokines don't just stay in the gut. They travel throughout the body, creating systemic inflammation. Recent research from Harvard Medical School has shown that these inflammatory messengers can cross the blood-brain barrier, explaining the connection between gut health and cognitive function. Recognizing inflammation in the body. The body communicates inflammation through various signals and symptoms, often long before blood tests show abnormalities. Unfortunately, many people either ignore these signals or treat them superficially, perpetuating the inflammatory cycle. Let's look at how inflammation manifests in different systems. Digestive symptoms. The most obvious signs appear in the digestive system: constipation or diarrhea, abdominal bloating, excessive or foul-smelling gas, heartburn, frequent belching, and recurrent yeast infections or urinary tract infections. A study in the World Journal of Gastroenterology found that over 70% of patients with IBS, irritable bowel syndrome, show markers of low-grade inflammation, even when standard tests appear normal. Liver and metabolic symptoms. The liver, as the primary detoxification organ, often shows early signs of inflammation. Waking up nauseated, strong-smelling sweat, a thick yellowish coating on the tongue in the morning, and waking between 2 to 3 a.m., which corresponds to the liver's most active time in traditional Chinese medicine. Other general inflammatory symptoms include persistent headaches, fatigue, tinnitus, and vertigo. These are often dismissed as stress-related, but they frequently indicate underlying inflammation. Thyroid and skin manifestations. Inflammation affects thyroid function, leading to symptoms like minimal sweating even during intense exercise, weak or brittle nails, lack of energy, fluid retention, and dry skin. Skin and hair also reflect internal inflammation. Worsening melasma, acne, dandruff, dermatitis, psoriasis, rosacea, and premature graying before age 30. A 2019 study in the Journal of Investigative Dermatology established a clear link between systemic inflammation and various skin conditions. Hormonal and metabolic effects. Inflammation disrupts hormonal balance, causing severe PMS, decreased libido, intense menstrual cramps, weight gain or obesity, stubborn localized fat, excessive cellulite, and difficulty building muscle mass. Research published in the Endocrine Reviews journal demonstrates that inflammatory cytokines directly interfere with insulin signaling, thyroid hormone conversion, and sex hormone production. Neuroinflammation, perhaps most concerning, is how inflammation affects the brain. The emerging field of psychoneuroimmunology has revealed that inflammation is linked to anxiety, stress, irritability, mood swings, anger, poor focus and concentration, memory problems, food cravings, and sugar addiction. A groundbreaking study in JAMA Psychiatry found that patients with depression had 30% higher levels of inflammatory markers compared to non-depressed individuals, suggesting inflammation may be a cause, not just a consequence, of mental health disorders. Breaking the inflammatory cycle. Now that we understand how inflammation develops and manifests, let's talk about breaking this cycle. The conventional approach often treats symptoms without addressing the root cause. Have a headache? Take a pain reliever. Feeling down? Eat comfort food, often inflammatory itself. This approach not only fails to resolve inflammation, but often worsens it. To truly heal, it's necessary to start with the foundation, optimizing digestion and reducing inflammatory triggers. Dietary interventions research consistently shows that an anti-inflammatory diet can significantly reduce inflammatory markers. This includes 1. Eliminating ultra-processed foods. A study in the British Medical Journal found that each 10% increase in ultra-processed food consumption was associated with a 12% increase in cancer risk. 2. Reducing refined carbohydrates and sugars. These spike insulin, which has pro-inflammatory effects. The American Journal of Clinical Nutrition demonstrated that high glycemic foods increase inflammatory markers within hours of consumption. 3. Incorporating omega-3 fatty acids. Found in fatty fish, walnuts, and flax seeds, these have potent anti-inflammatory properties. A meta-analysis in JAMA Internal Medicine showed that omega-3 supplementation significantly reduced inflammatory markers in multiple populations. 4. Eating colorful vegetables and fruits. These contain polyphenols and antioxidants that combat oxidative stress and inflammation. The Nurses' Health Study, one of the largest and longest-running investigations into women's health, found that higher intake of flavonoids was associated with lower levels of inflammatory biomarkers. Gut healing protocol. Restoring gut health is crucial for reducing systemic inflammation. 1. Identify and remove food sensitivities. Even foods considered healthy can trigger inflammation if there's a sensitivity to them. An elimination diet can help identify these triggers. 2. Support digestive function. This might include digestive enzymes, betaine HCl, if appropriate, and mindful eating practices. 3. Repair the gut lining. Nutrients like L-glutamine, zinc, and collagen provide building blocks for intestinal cell regeneration. A randomized controlled trial published in Gut showed that L-glutamine supplementation significantly improved intestinal permeability in patients with IBS. 4. What are T? 4. Rebalance the microbiome. This involves both probiotics, beneficial bacteria, and prebiotics, food for beneficial bacteria. A 2019 systematic review in the journal Nutrients confirmed that probiotic supplementation reduces inflammatory markers in various populations. Lifestyle modifications. Inflammation isn't just about diet. 1. Prioritize sleep. Poor sleep increases inflammatory cytokines. A study in the journal Sleep showed that just one night of sleep deprivation increased inflammatory markers by 20 to 30%. 2. Manage stress. Chronic stress activates inflammatory pathways. Practices like meditation, deep breathing, and yoga have been shown to reduce inflammatory markers. Research in psychoneuroendocrinology demonstrated that mindfulness meditation reduced the inflammatory response to stress. 3. Regular, appropriate exercise. While excessive exercise can increase inflammation, moderate exercise has anti-inflammatory effects. The Journal of Applied Physiology published research showing that regular moderate exercise reduces inflammatory markers by up to 60%. 4. Environmental toxin reduction. Minimize exposure to endocrine-disrupting chemicals in plastics, pesticides, and household products, which can trigger inflammatory responses. Chronic inflammation isn't just a health issue. It's a modern epidemic affecting millions of Americans. The good news is that by understanding its origins and manifestations, anyone can take control of their health. Remember, these symptoms, from digestive issues to brain fog to skin problems, aren't normal, even if they're common. They're the body's way of communicating that something needs to change. The journey to reducing inflammation isn't always easy, but it's worth it. Many people have transformed their health by addressing inflammation at its roots, often seeing improvements in symptoms they never realized were connected. Future videos will dive deeper into specific anti-inflammatory protocols and how to customize them for unique needs. If you found this information valuable, please subscribe to this channel and hit the like button. This helps the YouTube algorithm share this important information with others who might be suffering unnecessarily. Share this video with someone you care about who might be struggling with unexplained health issues. Together, we can spread awareness about chronic inflammation and help more people reclaim their health and vitality. Thank you for watching, and stay tuned for the next video.